The U.S. recorded one of the worst rates of maternal mortality in its history in 2021, and Black women continue to suffer the most. According to a new report from the CDC, 1,205 women died while giving birth or in the weeks afterward. That's more than 10 times higher than other high-income nations, and more than one-third compared with a year earlier. Caitlin Huey-Burns has more details.
Praise the Lord.
23-year-old Selena Martin was thrilled when she found out she was pregnant, but she was also concerned about getting the kind of care she needed.
One of my biggest anxieties was if I have to go to the hospital, I may not make it.
The stakes for pregnant women like Martin are high. Mortality rates among Black women are nearly 3 times higher compared to white women, a sharp increase from previous years.
There is certain levels of fear.
Caitlin Huey-Burns is an advocate for maternal and infant health.
What do those numbers say to you?
I think that it's contributed to a lot of things. Medical coverage, even access to care, like prenatal care. Here in Georgia, as an example, there's counties that don't even have a labor and delivery unit, an OB. I mean, that's unconscionable.
One thing that could help is having a doula, someone who guides women through the complexities of pregnancy, birth, and postpartum. Martin, a doula herself, has one for her own delivery next month.
I think the biggest thing that a doula can do for you is empower you. It's like calling your best friend. That's what we need. We need to know that we're being uplifted and taken seriously.
The states with the highest maternal mortality rates tend to be in the South, like here in Georgia. The author of the CDC report told us that she expects the rate to return to pre-pandemic levels. But health advocates we talked to say that number is still too high. John?
Caitlin Huey-Burns in Atlanta, thank you. For more, Eugene Declercq joins me. He is a professor of community health sciences at the Boston University School of Public Health. Professor, first, can you just put these numbers in perspective? How striking is the rise, and how does it compare to other nations?
I mean, we jumped about 38% between 2020 and 2021. And that puts us in a position where we're not only behind wealthy countries, behind poorer countries as well. And that's an ongoing challenge for us. If you took the Black maternal mortality rate and compared that to the rates in other countries we just reported, it would rank 99th. There'd be 98 countries that had a better overall rate than we have for our rate for Black mothers.
And I want to ask you about Black mothers in particular in just a second, but this is not a new problem. It's been made worse by COVID. Can you help us understand what was the underlying condition in terms of mortality rates in the U.S., and then how was that underlying condition made worse by the pandemic?
The thing we need to understand is when we look at maternal mortality, people tend to focus on the time of birth. They think of it at just that moment. The reality is that when we talk about it, we're really dealing with a period from pregnancy, and in most modern ones, we're looking at it to a year postpartum, or a 21-month period. When they looked at it that way, what they found was that only a quarter of the deaths were happening at the time of birth. And we've gotten much better at that, as it turns out. Where the real weakness in the U.S. system occurs is during pregnancy and in the postpartum period, because we don't have community health support in the same way that other countries do.
And is that, as we return now to the topic of the maternal death rate among Black Americans, is that what is part of the leading cause in that instance? The community health
part of it. It's not all of it. We still find issues of discrimination in the case of Black mothers in particular, but that's all at the time of birth. What happens is when we lose 3/4 of our women in the period before or during their pregnancy or in the postpartum period, that's a community problem. And what happens typically is a mother may give birth. If she's on Medicaid, there's a decent chance she's going to lose her Medicaid 60 days out and fall out of the system. So we have just too many cracks in the system now. It's too easy for people to fall through those cracks.
And so then what happens in those instances? What kinds of illnesses are we talking about? That and what would the fix be?
The fix would be to have a system that kept people continually in care. I mean, this is really a women's health problem that we're focusing on one small component of it. Mm-hmm. And the reality is about 10% of women don't even have a postpartum visit. And beyond that postpartum visit, many get no care whatsoever. their focus, understandably, is on their babies, but at the same time, they're facing various difficulties. For example, cardiomyopathy, one of the most common causes of maternal death, particularly for Black women, often doesn't manifest till some months after they've given birth. But if they're out of the system at that time, no one may pick it up until it's too late.
Okay, Eugene Declercq, thank you so much for being with us.
Thank you.